Hi, my name is Marisela Pazmiño, and I'm going to talk about refining antithrombotic therapy for atrial fibrillation and acute coronary syndromes, or PCI. Definition: antithrombotic therapy has been used for atrial fibrillation or acute coronary syndromes undergoing PCI. ACS is the result of an obstruction of a coronary artery, while atrial fibrillation is a common type of supraventricular tachyarrhythmia characterized by uncoordinated atrial activation that results in an irregular ventricular response.
Your heart is a muscle that pumps blood around your body. It's made up of 4 chambers, 2 at the top called the atria, and 2 at the bottom called the ventricles. Your sinus node sends out electrical impulses. Atrial fibrillation, or AF for short, is when other areas of the atria send out electrical impulses too. These irregular impulses cause the atria to twitch. When this happens, blood isn't pumped out effectively, which could cause a blood clot to form. If this clot travels to your brain, it can lead to a stroke. When your heart isn't pumping blood properly, it can lead to symptoms such as tiredness, dizziness, or feeling faint, shortness of breath, or palpitations. How AF affects you will determine the treatment you need. Some people with AF, like Harry, only have mild symptoms or may not experience any symptoms at all. Harry noticed something might not be right when he felt his pulse was irregular and sometimes fast. Harry was at higher risk of AF because of his age and high blood pressure. Those with a heart valve problem are also at a high risk. It's important that Harry avoids further strain on his heart by getting treatment for his AF to reduce his risk of stroke or heart failure. The best course of treatment for Harry was anticoagulant medicine called warfarin to reduce his risk of having a stroke, followed by a cardioversion to try and restore his normal heart rhythm. However, some people may need other treatment, such as ablation or other suitable medication. Thanks to his treatment, Harry's AF is manageable and he can return to work and exercise when he feels ready. For more information on living with atrial fibrillation, visit bhf.org.uk/AFib. BHF. Beat heartbreak forever.
Hey everyone! Today's lesson from Health Ed Solutions is on acute coronary syndrome. Don't forget to visit us online at healthedsolutions.com to certify or recertify your ACLS, PALS, BLS, or NRP 100% online. Now, let's get started. Patients with chest pain signifying ACS will complain of retrosternal chest discomfort. Pressure or chest tightness is a common symptom. Pain can radiate to the shoulders, neck, arms, and jaw. Sometimes chest discomfort is felt in the back between the shoulder blades. They may also complain of lightheadedness, dizziness, syncope or near syncope, diaphoresis, or vomiting. A significant finding is sudden shortness of breath with or without chest discomfort. Some common differential diagnoses include aortic dissection, acute pulmonary embolism, acute pericardial effusion with tamponade and tension pneumothorax. The American Heart Association's STEMI chain of survival represents the actions of the responder in situations where the victim may be experiencing ACS. The links include rapid recognition and reaction to STEMI warning signs, rapid EMS dispatch, EMS transport and pre-arrival notification to the receiving hospital, rapid assessment and diagnosis in the ED or cath lab, and rapid treatment. This was developed keeping in mind the role of both family members and healthcare providers. The first link represents the interaction between the patient with ACS symptoms and the emergency dispatcher. Trained and deputized dispatchers can prescribe emergency medications over the phone. For example, Dispatchers can recommend aspirin to ACS patients, but they should be able to diagnose the patient accurately through the phone and make sure that the patient has no contraindications to taking aspirin, such as allergies or gastrointestinal bleeding. That's it for our lesson today. Thanks for watching, and remember to check out our website at healthedsolutions.com for more free content or to get certified or recertified online.
Coronary artery disease is narrowing of the coronary arteries secondary to several risk factors, some of which are cigarette smoking, hypertension, hyperlipidemia, and diabetes. Percutaneous coronary intervention, or PCI, is a procedure used to treat and evaluate partially and completely occluded coronary vessels. Atherosclerosis results from endothelial injury, inflammation, and accumulation of lipoprotein, leading to intimal deposition of particles and narrowing of the coronary artery. The stenotic vessel makes it difficult for red blood cells to pass through. Therefore, the risk of ischemia and infarction is increased. During a percutaneous coronary intervention, an incision is made to isolate the femoral artery. A catheter is inserted into the artery and guided up the aorta to the heart. Live angiography is used to guide the catheter to the obstructed coronary artery. Radiopaque dye is injected into the artery. Imaging determines the location of the stenosis and the diameter of the vessel. Once the vessel is isolated and the obstruction located, a guide wire is threaded through the catheter to the location. The catheter is removed, leaving the guide wire. A balloon catheter is pushed over the guide wire and centered over the blockage. The balloon is inflated to open the narrowed vessel. The balloon is inflated and deflated multiple times to gradually widen the occluded vessel. To ensure that the artery remains unobstructed, a second balloon catheter with a stent is threaded to the location. The balloon is inflated, expanding the stent. For some patients, drug-eluting stents are used to decrease the chances of in-stent stenosis. Drug-eluting stents are coated with a material that will retard new intimal hyperplasia. Blood flow through the coronary artery is restored.
Applications in medicine. The Augustus trial was a 2x2 factorial randomized comparison of apixaban with a vitamin K antagonist and of aspirin with placebo that involved 4,614 patients. The trial evaluated the effects of these interventions on bleeding events in patients with AF who had an acute coronary syndrome or underwent PCI, or both. This trial led to the conclusion that a direct oral anticoagulant should now routinely be recommended for patients with AF who had an ACS or undergo PCI. Pros and cons. Pros: there was a lower incidence of bleeding events when a direct oral anticoagulant was used in combination with clopidogrel than when a warfarin-based triple therapy regimen was used. And there was reduction in death and hospitalization with the use of apixaban instead of warfarin. Cons: the use of aspirin led to a high risk of bleeding. Clopidogrel was the P2Y12 inhibitor that was used most in the dual pathway regimen, and there is uncertainty regarding its response variability and efficacy, particularly when it is used without aspirin. Issue applied in Ecuador: the use of different anticoagulants should be promoted in Ecuador as well as a better control of the INR. Warfarin is the most used anticoagulant for this kind of treatments. Treatment should be based on the risk present on the patient, such as cardioembolic stroke, coronary ischemic events, and bleeding. Conclusion. Conclusion. Not every patient should be treated with the same medications. The Augusta trial led to specific recommendations that will establish a new standard of care of patients with the previous conditions instead of relying on vehicle therapy. Now, practitioners can figure out the best way to treat patients with AF and ACS undergoing PCI through the correct antithrombotic therapy. Thank you.